I have PPE on for me and all of my crew. The scene is safe, and I only have one patient, and her mechanism of injury is that she has slurred speech, and she's having trouble moving parts of her body. She is my only patient at this time, so I will still be requesting extra EMS support. And at this moment, there's no need for a C-spine, but I'll be keeping it in mind for the future. Now, my patient does. So I'm gonna ask my patient. Hi, my name is Ryan. I'm an EMT. How can I help you today? And she's gonna respond to me, oh yeah, I'm just having trouble, moving her face, but you can see only half of her face is moving, and she leaves up one arm, but you can see, I noticed that one arm is kind of dead to the world, and she responds to me, so doing this, I can tell that her airway is open, so since she's talking to me, I'm now going to read her. So while talking to her, I'm going to put my hand on her and just ask her, can I take your pulse and your breathing? Just so I can take her, or can I take your pulse? And I'm gonna put my hand right here so I can feel her breathing at the same time, so I can count, and I'm gonna count that her pulse and her respiratory rate are both normal at this time. But so now I'm gonna ask her some questions. So I'm gonna ask her, when did this first start? And she said, about an hour ago. And during that time, what were you doing? And she said, oh yeah, I was just playing with my sister. And okay, how does it feel? Is it painful? And she's gonna say, no, it's not painful, but it's just very uncomfortable. And I'm gonna ask, is it radiating anywhere? Like, where is it hurting? Where can you feel it? And she's gonna say it's around her head and basically just half of her body. And I say, is there anything that you do that makes it worse or better? And she's gonna say no. On a scale of 1 to 10, how do you feel about this? In like a scare or painful level? And she said her pain is about a 5. It's not horrible, not great. So I'm now going to give me a secondary assessment. Okay, so her symptoms, so I'm gonna ask her about her symptoms, and she's not gonna have, the symptoms is just the drowsiness, and not drowsiness, the having trouble slurred speech with the not very good control of half of her face and half of her body. Does she have any allergies? Does she have any allergies? And she's gonna say no. Is she taking any medications? And she's gonna say no. And does she have a history of anything, any kind of medical issues? And she's gonna say yes, and she has history of strokes before. So that's gonna go with my past history. When was your last oral intake? She's gonna say about 3 hours ago. I'm gonna say okay, so about noon, about 12:30. And what were you doing on the events leading up to this? And she's gonna say that she was just playing with her sister. And now I'm going to be asking you questions. Sam. Okay, so it's hurting. So at this point in time, I'm thinking that this is going to be a neurological issue. So I'm thinking that this is a stroke. So I'm going to be asking a question. So I'm going to be having her do some things. to make sure that I can tell. So previously, I could see that she was talking, and when I went up to her, she was watching me, so I could see that she's aware also. But I'm going to have her do some stroke tests, and she's gonna fail them, and she ended up failing them. So now I'm going to do a reassessment. I'm gonna check her pulse, her blood pressure, and her respiratory rate. And they are all going to be normal except for her blood pressure, which is going to be a little high of 130/90. And now I'm gonna diagnose her at this time that I believe that she is having a stroke, and so her level of severity is very high, and I'm going to need to get her to the hospital as quickly as possible. So everything I went over is that her baselines are pretty normal except for a high blood pressure, and that she is having a neurological issue because she's having trouble moving parts of her body. Now I'm going to be taking her to the hospital. Thank you. Bye.